Now we go ahead with operative vaginal birth record keeping. And essentially, what we have here is a form of a birth record which is has become important since the time of the Montgomery ruling, and you need to document all of these things for the purpose of your clinical governance, okay, in the UK. So everything regarding the where the station was, what the sutures were like, caput molding, etc., in detail needs to be mentioned, okay, in a pro forma format, and what instrument did you choose, and if at all you chose multiple, which ones did you choose? Everything needs to be written in this pro forma, okay. All right, now let's go over the choice of instrument before we see safety. So this is my second stage, okay, decision making algorithm, right now. Okay, so the what is the first step that you will take when you are considering the delivery? For example, whether you will have, what options will you have? You will have the option of doing a cesarean section, okay. Hmm? They might even give you a category of the cesarean section as cat 1, cat 2. Then they might give you forceps, and then they will give you different locations where you will choose the forceps. They might even say mid, low, outlet. Okay, these options may be there. Like in an EMQ, they'll give you mid cavity in theater, mid cavity here, or mid cavity in or low in theater, or low in the ward. This is how they will give phrase different options for you. Then similarly, you will have vacuum with multiple options, permutation combinations being made of the same. Yeah, or they will give you options like you can wait and ask her to push for half an hour, wait and ask her to push for another hour, okay, right? So you need to know exactly whether you have developed an indication to deliver, okay. Second thing you need to be clear about is where to deliver. Third thing you need to know is what, which instrument, okay. These are your things you will choose. uh, please pay attention. Please wake up everybody who is sleeping. This is the crucial part, most crucial. I would say SBs are gone now. EMQs have started now. Dr. Pallavi, Kyle,
Yes, ma'am. You're there.
yeah, no? Okay, good. Vishaka, shout out to Vishaka. Yeah, okay. So, well, now the first thing we are going to see is if we are going for an instrument, alright, are we in low outlet with no rotation, okay. Low, see, all of them may be there. Low outlet, no rotation, so it cannot be a rotational low, which also becomes categorized as a slightly more difficult, because if you are putting keylets, you're not going to do it in the what. Now usually low rotation doesn't happen, they will be less than 45 degrees, but in case it comes up, okay, I'm covering all ground here so that you don't ever get confused. Now, so low outlet, no rotation, easy instrument. Please favor instrumental delivery over a cesarean section, no matter, even if you have a relative contraindication in the question. When we said that don't put it if fetal bleeding disorder is there, or don't put it if you have the risk of fracture in the baby, okay, right? What are we trying to say here? We are not ruling out instrument because that factor came up in your question. Please note that doing a second stage cesarean section with a head which is that low, okay, will be more detrimental. So then we are choosing to take a risk in favor of an instrument, and which instrument, if at all? Which instrument? Come on, guys.
Low outlet.
Which instrument out of the two?
Forceps.
Forceps, yes.
Ma'am,
Okay.
low outlet.
Low. low outlet, I mean, who asked that question? Low or outlet resistance depending on the station. See, what I'm trying to say here is that if it is a low or outlet without rotation instrument, station, okay? Now, if your Ventus, which Ventus, if you have those relative contraindications to Ventus, okay, they will give you a reason why you have to pick forceps over Ventus. Okay, because otherwise in the guideline, there is no reason why you should choose anywhere between the two, right? What does it clearly say? It says depends on the expertise of the person,
Mm.
doesn't it?
Yeah.
It
Operator's
depends.
choice.
Yes, it depends on the operator's choice. So when it depends on operator's choice, it cannot be that half the time they will mark this as right or that as right. The answer has to be one answer, and there will always be a reason in your question why you preferred forceps over ventus. Okay, and the reasons are all those things that I stated before. Okay, so now if, however, you have a mid cavity or rotational, okay, mid cavity or rotational, then with a risk factor for failure, meaning, okay, you have, look in your question very carefully, you have BMI more than 30, short stature in the mom, big baby, head circumference is big, this has never been mentioned, but occipito-posterior or rotational we have said, or OP in general, mid pelvic we have said that, or if the head is more than a fifth palpable actually more than two-fifths you will not apply at all, that is a contraindication, but so head is one-fifth palpable, not more than but equal to one-fifth palpable, meaning we are saying that there is a risk of failure. Okay, risk of failing that instrument is high, which means that you may require a cesarean section if you fail, right? So, you'd prefer in all these circumstances shift to theater. So, your location changes. Your location was deciding place and level, right? So, location was ward, labor ward. Here, your location is theater and it's a trial on instrument, as in it's in the word itself. You're going to try, doesn't happen, then prepare for possible cesarean section. Second step, check for relative contraindications to instruments in general first. Okay, so if they are present, contraindications to instruments are present in your question, all right, and the birth is urgent, okay, no matter where they have given it, even if instrument is possible, you go for a cesarean section. Okay, meaning what we did in the question in the morning is you are not going to wait around if it's a very quick delivery is required. Trial in theater may take time and may also fail. So if it's a difficult instrument but you are applying for an indication such as prolonged second stage, it's perfectly all right. However, you are applying it for an indication with fetal compromise as well. What would you do?
Cesarean.
Yes, so that's your choice. Okay, so it's not 1 plus 1 2 mathematics, and somebody can give you an easy like formula for this. But you need to consider these factors in your questions, and why I'm like emphasizing on it is they will often be present, and people like ask, okay, this is mid cavity application. Why not choose it in theater to apply it, etc., etc. Remember that there will always be a reason why you didn't choose that. Okay, it's never random assortment of choices, no. Okay, so as I have said, place is important, choice of instrument is important. So now they can't give you say like rotational vacuum or rotational forceps both in theater. They will either give you rotational forceps in theater, rotational vacuum in the ward. So you have to read the options very carefully because they won't give you two correct options. Okay, if it depends on our operator choice, the option will always have either the wrong place or the wrong type or category. Okay, am I being clear?
Yes, ma'am.
Yes, so either the category will be wrong, the play or the place will be wrong, or the overall method itself will be wrong because of some sort of like contraindication being present in the question. Okay, so now, say maternal exhaustion is given to you, right? And now you have both, the station is at +3, and both the options are there of vacuum in low and forceps in low. What will you go for? You know it's a low instrument. So first you've decided it's low instrument and you want to put it in your labor ward itself. Okay, it's non-rotational. You're going to apply it in the labor ward. But now you're confused. How can they give both low? Reason is she's exhausted. She can't push. Or they will give cardiac, some like milder heart disease or something, and then they will say that she's advised not to perform Valsalva, not to push at all. You're going to go for forceps, obviously. Okay, obviously with Ventos, you require maternal effort, which you want to eliminate. Okay, so the best option out of them, you have to choose it is SBA, isn't it? EMQ means that single best option. You can't have like two answers which are right. Okay, okay. Now,
I have a question here, ma'am. If a woman is under the effect of epidural analgesia, then in
hmm.
that situation also we will prefer forceps because women cannot push that effectively and the vacuum is always assisted. So will we choose a choice of instrument will be forceps in that scenario also?
No, not necessary that she can't push. She can push with this thing. Exhaustion is the only reason she cannot push. What is directed pushing? Directed pushing is when she has a contraction, you can tell her to push. Now, if you are asking me if both the options are there, the contraindication wouldn't arise because merely because she's on epidural. No, you can't choose, but you can't have an option question asking
But if
you,
the both options are there,
did you come across something like this?
okay. Because I saw some question like that in Master MRCOG, so that's why I'm asking, ma'am.
Do
Hmm.
send it to me.
There was
We'll
some
read it
question like
again.
that I
Yeah,
came across.
we'll read it again and
Okay,
see
ma'am.
any.
Okay, ma'am. I will.
Yeah.
Okay,
Okay.
ma'am. Only if I
Okay.
can find it. I did not take a screenshot of it. I'll see if I have.
Okay. Okay. Do let me know. Hmm? So, yeah, generally, contraindications to Ventus, so that you prefer a forceps would be gestation and fetal conditions like prematurity, suspected fetal bleeding, and hemophilias, bone fragility. We have covered this, going over it for completion's sake, and need for immediate delivery, clinical situation when the time is critical. Ventus is slower, don't go for it. Okay, forceps is quicker. So if you have acute fetal distress and instrument is okay, that means you don't have something too difficult, non-rotational and low or outlet, and you would prefer a forceps. Why? Quick. All right, quick. And failure of vacuum pop-offs would be the reason why. Maternal exhaustion, as I have mentioned. Okay, these are your common things in your questions. Okay, isn't it? Dr. Jaspreet, common things in your questions. Yeah. Dr. Pallavi, Ranjana, Niroj, clear?
Ma'am.
Okay.
Yeah, yeah, yes.
Now, again, another thing which comes up is they will give you which instrument and then names of instruments at times. So you should be aware what ones can come up. Wrigley's is the short one. So remember W for W in the ward for Wrigley's, and the low and outlet deliveries can be done in the ward. So Wrigley's can be put in the ward, and it's a short length one, safe for outlet, and after coming head of the breech as well can be done with it, and less risk of uterine trauma with this, but longer forceps will be. Piper's is the one which is actually, the preferred one for allowing the curvature of the shanks to accommodate the baby when after coming head is used. But if this is given, choose this one. However, if it's not, you can sometimes go for a release. Longer forceps names certain categories. There would be Simpsons, Elliott's, Neville Barnes. Keelan's is the rotational guy. Okay, so Keelan's has a minimal curvature, pelvic curvature. So when you're rotating it, it doesn't shear um, the vaginal walls, for example. Okay, so that's the importance of it. So best for rotational. Huh? Neville Barnes is very commonly used. Okay, go over the forceps videos, please. How many have seen it already? Okay. Now, as promised, we go over the algorithms and again, important aspect of your questions from here. Safety criteria, we have seen all of this, but again, the head is in mid pelvis or rotation or 1/5 palpable abdominally or suspicious features of CPD. What were they? Caput and Kaput high head mid pelvis rotation being required. Kaput may be there 1 plus. Okay, up till 1 plus. Why? Why? 2 plus or more is no instrument at all. Okay, unsafe, not safe. So now you're going to do, unless you have any of this, you continue in the labor ward, low pelvic or outlet ones, no rotation, no feature of CPD. Now, optimal instrument we have seen as per competency, but in your exam it won't depend on competency. There will always be a factor which will make you decide between the two of them. Okay. Now select an instrument which is least likely to fail. Now, what does this statement actually mean? It means that although you have the liberty to decide between ventus and forceps, GTG itself makes it a point to say that because forceps are less likely to fail, okay, somebody may be advised to choose this particular one if they feel like vacuum is going to fail majority of the times or because of any difficulty, then you don't want to put a vacuum after a forceps sequentially, okay, or forceps after sorry put a ventouse after a forceps or a forceps after a ventouse. Usually it goes with vacuum failing and then you requiring to put a forceps. But you want to avoid that because that is associated with the maximum fetal and maternal trauma. Okay. So because of this, we don't want that situation and we want that we put something that we are sure might work. Okay. Vacuum again assisted not to put in under 32 weeks and caution between 32 to 36 weeks. Now, whoever is applying the instrument, if they are not able to achieve the correct application, okay, they will check again for the position, sutures, etc., and get an opinion if they are not able to do it at this step. But your question doesn't start here ever. Okay, because it's a bit too easy. They've told you you're not able to apply, then what will you do? Answer is obviously get a second opinion. Okay, but it will come from the time that you have attempted a rotation or attempted to do the delivery or you're pulling, for example. Okay. Now, can someone tell me with vacuum, what do the words pop off and traction mean, pulls mean? I know that many are confused about this concept as well. But yeah, so just I wanted to know what your thoughts are about this. Okay.
Pop-off means it gets totally detached,
Hmm. Okay.
and only two pop-offs are allowed, and three pulls are allowed with the vacuum.
So is it that you pull then it pops off, you put it again and it pops off and then you put it again? Or what? Suppose like I pulled once and then
No,
it didn't pop off. Okay. I pulled I did one pull. Nothing happened. It didn't pop off. But
hmm.
within contraction, I'm pushing, I'm asking her to push again. Uh, I did another pull. Now this time I got a pop off. Okay. Now I have applied it again. Okay. The time that I pull, okay, it hasn't popped off. What should I do?
There's no descent, so we should discontinue. Two times you've already pulled. So there's no
Okay.
descent at all, then you should stop. Then you should stop there if there's no descent at all. If there's minimal descent, then you can, of course, you can try further.
Try what further? Okay. Okay. Let me
You can
make
try it to
let
pull it
me
further.
not we won't do hypotheticals. We will do an exact scenario. Now it was at I'm applying at +2. No, I'm applying at 0. Okay, I'm applying at 0 in theater Ventus. Okay, it's non-rotation, but it's high, and I'm applying. It's like less than 45 degrees, but I'm applying, and then I have made one pull and another two pulls. Then one pop off I got. Okay, and then I have put it again, and I did a third pull. Now I have noted that it is at +2. Now what do I do? Hmm. More 3 ml. Okay. Dr. Pallavi.
Small gentle three pushes, three this we can give.
What? I didn't. What are you going to do? Sorry?
Uh, Maybe apply a forcep.
Okay. Now let's see. Your options are stop, abandon, go for a cesarean section, give another three pulls. Mm, then option may be yes and another one pull or two pull or three pull. These are your options. And to go for a sequential instrumental delivery is another option.
It has come to the perineum.
It's not come, I said it's +2.
Ma'am, it has come till the perineum or not?
No, no, +2, +2. It came from 0,
We
now
can
it's come
try three more gentle pulls because
+2. From 0, we started at 0, we have come till +2. I didn't ask you that simple a question.
Mhm.
Okay, it's come to +2 alone. Okay, this one is a difficult scenario. Okay, difficult scenario. All right. Okay, if okay, only in case of extremely experienced operators would go for sequential. In this situation, despite three pulls, we haven't got much descent. Okay, three pulls total. It doesn't have to be, it can be one pop off with three pulls. Okay, it can be two pop offs with two pulls. You don't do a third pull with another application after a this thing like if you applied one while doing the first pull itself you had one pop off, the second pull you had another pop off. It's not allowed to go any further. You're popping off. No, popping off causes scalp laceration. Okay, also popping off means that something is stuck and you're not applying it properly. That means no further. All right. Unless your third pull has caused it to descend to a great extent and delivery is very imminent, then and only then three more gentle pulls will, you are absolutely sure, will deliver the baby. Only then you go for the fourth, fifth, sixth pull. Got it? Let me show you now. Okay. So, if you're unable to achieve any rotation in case of rotational, call senior, discontinue if rotation is not being achieved with correct application or with the pull. Okay, now note here attempt traction. This is where your question usually starts. You have attempted if progressive descent, again the same words, progressive descent was occurring in second stage. Here also same thing, progressive descent with the pulls. check the instrument, check for CPD, take an opinion if at all. Experienced operator may revise, like they may change the instrument or alter the direction, whatever it is. Discontinue descent is not achieved with the above, and discontinue vacuum में birth is not imminent after 2 pop-offs. Okay. Reassess after 3 pulls and consider discontinuing forcep if after 3 pulls head is not crowning. Okay.